imposed, as you know, stringent travel curbs to the country as the World Health Organization has declared COVID-19 outbreak a pandemic. With 70 active coronavirus cases in the country, the centre has suspended all existing visas to India except visas for diplomats, UN officials and those with employment visas till the 15th of next month. Visa-free travel facilities have been granted to overseas citizens of India that have also been suspended. Indians who have travelled to the following countries: China, Italy, Iran, South Korea, France, Spain and Germany after the 15th of February will be quarantined for a minimum period of 14 days. These curbs will go into effect from the 13th of March. Prime Minister Modi has tweeted asking people to avoid non-essential travel. The centre has also invoked a British-era Epidemic Diseases Act to tackle the spread of the virus. The decision was taken at a meeting of a group of ministers headed by Health Minister Harshvardhan. Remember, 2 fresh coronavirus cases have been reported in Mumbai and one from Andhra Pradesh, taking the total number of positive cases in the country to 70.
In view of the further spread of coronavirus, the government decided yesterday to take more stringent measures in regard to international travel. All existing visas, except diplomatic, official, UN, international organizations, employment, project visas, stand suspended till 15th April 2020. Visa-free travel facility granted to OCI card holders has also been kept in abeyance till April 15, 2020. All incoming travelers, including Indian nationals, arriving from or having visited China, Italy, Iran, Republic of Korea, France, Spain and Germany after 15 February shall be quarantined.
This is primarily the people who have either a travel history or as well as a contact history and also who are symptomatic. See, it is very important that we should not create panic. Only people who need to be tested should be tested. Similarly, with respect to the testing regions you mentioned, country is already prepared. We already have around 1 lakh testing kits available. Additional testing kits have already been ordered and they are also in procurement.
मैंने स्वयं दिल्ली के एयरपोर्ट पे जाके 3 घंटा लगा के उसका एक जब 4 फ्लाइट भी एक साथ आ जाए तब भी क्या कोई मिस होने की संभावना है, उसको भी हमने पूरा डिटेल में एसेस किया है. और खाली स्क्रीनिंग में अगर वो नेगेटिव है, इसका मतलब ये नहीं है कि वो जो है पॉजिटिव जो है 2 दिन के बाद नहीं हो सकता. ये हमारे जो पहले 7 एयरपोर्ट हमने 17 जनवरी को जिनके ऊपर स्क्रीनिंग शुरू की थी, उसमें दिल्ली, मुंबई, कलकत्ता, बेंगलोर, हैदराबाद, चेन्नई और कोची इज अमंग्स द फर्स्ट 7. टुडे वी आर डूइंग इट ऑन 30 एयरपोर्ट्स और 30 एयरपोर्ट्स पे अभी हम सारे दुनिया की फ्लाइट्स के बारे में कर रहे हैं. इसलिए स्क्रीनिंग के संदर्भ में आपको कोई डाउट वगैरह नहीं रहना चाहिए.
Well, after the travel ban, airports wear a relatively deserted look. India Today's reporters have fanned out to bring you these ground reports from airports across the country. This is what they look like.
Several precautions are being taken at Mumbai International Airport due to coronavirus. But look at this condition at the airport first. It looks completely empty. You can see at the check-in counters, no crowd over here, no much of passengers. In normal day, it's completely packed, long queues, but look at the situation due to coronavirus right now over here. Now, there are several precautions being taken at the Mumbai airport. You can see the CISF officials over here who are wearing masks. They are asked to use sanitizers every time. The medical checkup equipments are also being sanitized all the time. Now, there is a team of over 100 doctors and paramedics who are present at the airport, who are working round the clock for the medical checkup. Now, 15 countries where the coronavirus has been affected very badly, like Italy, Iran, China, Korea and other countries, their checking has been done separately. This has been started from yesterday, and whoever the passenger shows some signs of suspected coronavirus, they are immediately taken through the ambulance to the Kasturba Hospital, which is the dedicated hospital for coronavirus in Mumbai. With camera person Vijay Desai, this is Saurav Vakhtania in Mumbai for India Today.
The state government is scanning all the inbound passengers coming from abroad. Nearly 72,000 people have been scanned and 6,000 people have traveling history of abroad in Punjab. 4,000 people have undergone the mandatory 28 days of observation, and nearly 1,400 people are currently on observation. Punjab government has also launched an application, Kora Punjab, by using which people can report symptoms similar to coronavirus and can approach the nearest hospital. The state government is also scanning the passengers at international borders, be it the Guru Nanak, Dera Baba Nanak or the Atari border. So besides this, nearly 1,400 people are also currently under scanning, and out of 1,400 people, 300 are under home observation in Mohali district. So the Punjab government is taking all efforts so that the coronavirus do not spread and people lead a healthy life. With camera person Dilip Sahu, this is Manjeet Sehgal in Mohali for India Today.
We're at the Chennai International Airport, and as you can see, the number of flyers as well as people coming here to collect their family and friends have actually decreased at the Chennai International Airport, and this ever since the outbreak of the coronavirus. But there's good news for people in Tamil Nadu, which the Health Minister Dr. C. Vijayabhaskar did tweet, where he said Tamil Nadu is corona-free, as the one person who tested corona positive, a flyer, a passenger who came in from Muscat, Oman, has had a speedy recovery. But airport authorities have made it very clear that all the people working here have to wear masks. This includes the CISF, the people of the employees of the airport, as well as the guards on duty. Everyone has to wear masks. There are also ambulances that are kept here. Inside the airport, passengers are being screened as they deboard, temperatures being checked, self-declaration forms being signed inside the aircraft. The captain and the crew make repeated announcements. Inside the airport, there are also sanitizers kept. There are information boards as well, and also there are people they can go to for help in case they feel feverish, they have a cough or a cold. There are ambulances here on standby which are kept just to take them to the Rajiv Gandhi Hospital, where they will have a checkup and the sample will go for testing. Now in Tamil Nadu, very recently they launched the second lab for testing. Earlier it was only the King's Institute in Guindy. Now the Theni Medical College has also opened up for testing. There are 330 isolation wards in the state of Tamil Nadu, but the Tamil Nadu government is on a mission to increase the number of isolation wards to battle the epidemic. Also in malls, in theatres, in multiplexes, in schools, colleges, several institutions, even at village level, the government is trying to rope in people to have awareness camps so that even villagers are aware of what the coronavirus is. The government doing everything it can to take necessary steps to tackle coronavirus. But here you can see the airport bears a very empty look, and this is solely because of the virus outbreak. The video journalist Divyan, this is Shalini in Chennai for India Today.
Well, after the government imposed those travel restrictions to contain the coronavirus, there are multiple questions in the minds of people. They're only natural. India Today's Pooja Shali takes you through this simple FAQ. Here's an explainer. It will answer some of your questions.
We have prepared some basic FAQs for people to know, only verified information being put out via India Today. So the first, what is India's latest travel ban? Because that's what everybody is asking about. India has suspended all visas starting March 13th till April 15th. So a month of that period is being provided for the travel ban. But can my family abroad visit me in India? Which is of course referring to Indian overseas citizens. No travel ban on Indians coming home, but is not advisable. This is a self-precautionary measure that the people, especially who are Indian citizens, are best advised to take. I am an overseas citizen of India. Can I come home? Answer no. Your visa is also in abeyance till April 15th. So this means all visas have been suspended for now. However, there are also some options that have come in. So these are some of the people who completely do not have visa opportunities. Should I plan a foreign visit? No, unless it is on extreme importance or perhaps essential of nature. The government and in fact External Affairs Minister S. Jaishankar himself saying that it is not advisable to visit any country right now of this issue. Can a foreign national visit India? No, unless again a compelling reason. So these are some of the basic FAQs, including how can foreigners then travel to India if required? By contacting the Indian mission. So living abroad, you can definitely approach the Indian mission. I visited China, Italy, Iran, South Korea, Europe after February 15th, some of the countries with infected cases. You face a compulsory quarantine period of 14 days if and when you come to India. So whenever you return, you will have to be in a quarantine period for 14 days. Can I enter India with and via the land border? All options being explored only at designated checkpoints, and that is with due screening. So even if you're not alighting at an airport, there will be a screening that will be done. Can I take domestic flights? Yes, there is no bar at all on the domestic flights that are being taken, at least until this very moment.
Now I want to go across to India today. Saurabh Vakhtania, who's live with us from Mumbai. Gopi Krishnan is live with us from Thiruvananthapuram. Saurabh, coming to you first. 2 cases of the novel coronavirus in Mumbai. What is the current status, and are all arrangements being taken in the city of Mumbai? You know, all eyes are going to be on Mumbai because of the travel bans right now. It is India's financial capital. Walk us through what the arrangements there are.
Well, Shiv, lot of precautions are being actually taken by the government of Maharashtra. Now, there are total 11 active cases in the state of Maharashtra. 2 of them are from Mumbai. Total 3 hospitals are being made officially, which are dedicated for the state of Maharashtra. 1 is in Mumbai, 1 is in Pune, and other is in Nagpur. Now, the precautions measures are like there is a proper isolation ward which has been made. Now, over 1,000 passengers have gone abroad through a travel agent, Shiv. Now, they have taken all the details from the travel agents. Once their flight lands back to Mumbai, they will be directly taken to the isolation ward. Now, what the very latest we are hearing, Shiv, is that many of the primary schools, the private primary schools, have decided to shut down for tomorrow, taking no chances and taking all precautions. Many of the schools in the suburbs have declared holiday from yesterday. So this is the most important thing which we are hearing. Now, with the ongoing budget session, there was a thing which was declared, which was been discussed, basically that for the IPL matches, the sale of tickets should be banned. So what will happen is that the players will definitely play matches, but it will be without audience, because remember, the first match of IPL is going to be played in Mumbai on March 29. But the decision has not been made. Chief Minister Uddhav Thackeray made it very clear that once we have a conversation with BCCI, we'll definitely speak on it, we'll definitely take a decision. But we are avoiding lot of public rallies, and lot of public meetings are already been avoided. Now, the most important question, Shiv, are the local trains of Mumbai. There are 3 lines: Harbour, Central and Western.
Okay.
Lakhs of passengers take this train. So what precautions need to be taken in this train is a bigger question. But yes, there is no need to be panic. The state of Maharashtra has already said
Okay,
that,
so the state is in preparations. There are 2 cases there, but all preparations are being taken. Gopi, a number of cases in Kerala. The last time we spoke, we were speaking about how there is a large effort by the government, to assess the many people who had come into contact with the last family that had been found to be positive. What's the situation in Kerala right now?
Well, Shiv, the massive efforts made by the health department to do the contact tracing of the affected family seems to have paid off very well. And that is, of course, one thing that we are seeing in the last 2 days. There hasn't been any fresh positive cases that were reported in the state in the last 2 days. But the alarming fact or a matter of concern is the situation of 2 elderly patients who are admitted in Kotte Medical College. Remember, these are the parents of the family which returned from Italy. And according to the government, they skipped the medical checkup in Sial in the Cochin International Airport, and they proceeded to their hometown in Pathanamthitta. And it was only after 6 days that the government managed to trace them, and when they were traced, they were also tested positive. So the parents of this family, which are about the age of 80, 85 and 86 respectively, these parents, their condition is slightly critical is what we have been told. Though they have been stable for the last 2 days, it hasn't come down to a point where people can be relieved of their condition. So that is one alarming fact that we have on one end. On the other hand, the preparations and the contact tracing and trying to reach out to maximum people, all these efforts are being made on war footing, and that is exactly what we are seeing on the ground. Speaking specifically about Pathanamthitta and Kottayam, these two districts, it is gradually shifting into a mode of self-isolation, people refraining to come out onto the streets. But nevertheless, it hasn't really affected the rest of the state except for the cinema halls and other public events which are happening.
Okay. Thanks very much, Gopi and Saurabh, for that.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.